I'm frequently asked, why does my doctor not understand hiatal hernia syndrome? Why have I lived all these years suffering, going from doctor to doctor, and no one has been able to figure it out? And before we get into the answer to that, let's review what hiatal hernia syndrome is so we're all on the same page. So it is, I called it a syndrome, and I wrote the book called Hiatal Hernia Syndrome. I use the word syndrome because it's a coming together of about 20 different symptoms that have a common underlying root cause. So the symptoms frequently start digestively. Patients have acid reflux, they have bloating, gas, they can have constipation, and then over time the digestive nature changes and is added to by things like shortness of breath and heart palpitations and feeling anxious, sometimes lightheaded or dizzy. Definitely feelings of mood swings can occur. People can have tingling into their arms. They can have pain in their jaw. They can have tightness in their chest and throat. They can regurgitate food. It's a very long list. And because if you think of what I've just talked about, acid reflux associated with the stomach, heart palpitations, heart, shortness of breath, lungs, anxiety, okay, hormonal, mental imbalance, right? Dizziness, who knows, you know, so all of a sudden you're broadening out into all these different organ systems, and that's the answer to the question of why doctors don't diagnose it, because our doctors there's two liabilities. One is in the general practitioner, your primary care physician, who is supposed to look at your body as a whole. He or she is very constrained by what's the disease or the syndrome, and then you prescribe the correct drug therapy as dictated by, you know, the agency supporting you, so the American Medical Association. And they're very, very constrained by that. What's the diagnosis and what did you give the patient? And so when you then go to the specialist, because your primary care says, I don't know, I don't know what's going on with you, and maybe you go to the cardiologist because you're having heart palpitations, skip beats, things like that, and you get a cardiac workup and it's negative and there's no heart disease, then the cardiologist says, well, there's no disease, and they are allowed then to give you palliative treatment to kind of help with your symptom. And I hear this from patients all the time too. It's like, well, my doctor says my heart is fine, but they gave me a blood pressure medication to slow down my heart because I've been having these heart palpitations. Or the pulmonologist says my lungs are totally healthy, but they gave me an asthma medication to kind of open up the bronchioles of my lungs to maybe ease that and allow me to breathe easier. The psychiatrist gave me an antidepressant or an anti-anxiety medication, hoping I'd feel better. So that's the sticky wicket, if you will, that we get stuck in, is that our medical system is very constrained by what's the diagnosis, you see. Now, you get into hiatal hernia. That is a diagnosis for sure. You can have an endoscopy and you can find out your stomach has pushed up above your diaphragm. Remember, 95% of these are sliding, meaning they go up and down, okay? But that is an actual diagnosis, and the procedures for that are an antacid, like a PPI medication, so that the acid is not creating so much destruction, and or surgery. I just recently, well, just yesterday, so it'll be out soon, probably by the time you see this, that warning, if you will, about surgery and what's promised as a result of these surgeries versus what the research shows they actually effectuate, being very different. So definitely check that out. So you can see why doctors are, because they're siloed into not just what's the disease or the syndrome and here's your drug, but also when you get into the specialist category, The cardiologist is only looking at your heart, and the gastroenterologist is only looking at your GI tract, and the pulmonologist is only looking at your lungs. So they don't crosstalk very well. And hiatal hernia syndrome epitomizes this problem because it's all crosstalk. Okay? What we have is a stomach that's compressed. When it gets compressed, it elevates. It elevates into the diaphragm because that's what's right above it. The diaphragm now spasms. Because it spasms, you feel short of breath. It has nothing to do with your lungs. Your lungs can be perfectly healthy, but if your diaphragm's in spasm, you're short of breath. Okay? Then the stomach and the diaphragm elevate, and what's right above that? What's right above your stomach and diaphragm on the left? Your heart. So now the heart's saying, get out of my space. This is my space. What are you doing here? And you get heart palpitations. That's the physical aspect. Now let's look at the nervous system, the neurological aspect, because there's a very special nerve, your longest cranial nerve, called your vagus nerve, and it goes everywhere. But let's say you learn about your vagus nerve and you go to a neurologist and you go, I don't know, I think maybe my vagus nerve is a little unhappy. And they'll say, vagus, do you have epilepsy? Do you have depression? Because that's what they treat. They do vagus nerve stimulation for epilepsy and depression predominantly. They certainly don't understand what I'm about to say, which is that there is an interplay between your stomach getting irritated and your heart then getting irritated because of there's a reflex going back and forth between your heart and your stomach. It's called the cardio-gastric reflex. Gastric is stomach. Also, there is a reflex between your heart and your esophagus. When the acid goes up your esophagus and it gets irritated, reflexively, your heart can get irritated. You can get less blood flow to your heart. You can get heart palpitations. Your heart rate can slow over and above what it should be. There's increased risk for heart attack. So the neurologist won't talk to you about this. So do you see the problem here? That's why as Root Cause Medical Clinic, this is the only way we've ever thought. It wasn't hiatal hernia syndrome. We've been doing this for 40 years, and hiatal hernia syndrome, honestly, we're 30 plus into it, but it's the only way we've ever thought. We think interplay because we look at the body as a whole and we realize organs, they're all communicating with one another, and they're not in isolation, and you can't take them in isolation and think nothing is affecting them. But time and time again, patients say, listen, doctor, I know that when I'm overly bloated and feeling acid, that's when my heart acts up. When my stomach seems more under control, I don't get those heart palpitations, or I don't get the shortness of breath. You've been suffering long enough, you figured it out. You figured out that interconnection, but you're told, no, that's kind of all in your head, or, well, you're under stress because of this. Trust me, we've looked at your heart, we've looked at your lungs, it's perfectly fine. Just keep taking your acid. Oh, and by the way, why don't you go see that psychiatrist? See? They're not trying to be insulting. They're not. It's just not how they're taught. And so it's kind of like that. And this is a hole. This is a hole in our medical system for sure, that we're not looking at the body as a whole and how it interacts, all the parts intercommunicate. But with hiatal hernia syndrome, that hole is, the size of the Grand Canyon, and millions of people are falling in it every single day. And it breaks my heart hearing from people saying, I've been suffering with this for 10 years. I've been suffering with this for 15 years. It's ruining lives, and it doesn't have to. It's not hard to fix. It's truly not hard to fix, and it's not surgery, and it's not drugs. It's getting to the root cause of, is it neurological vagus nerve? Is it gut related? Is it also structural related with not just vagus nerve, but other nerve irritation, muscle imbalance? It tends to be multifactorial, which is, I think, why our success rate is so high, because we offer all of that. here at the clinic. Oh, and we do telemedicine across the country. We do work with some patients internationally because I'm often asked that as well. So I wanted to do this video to really just tie together why you've been suffering and why nobody can figure it out. And it's time to figure it out, and you deserve to be figured out, and you deserve to have this whole thing resolved. And I can't guarantee that. Of course, we don't have a 100% success rate, but we have a very high success rate. It's 85%. And so if we think you're a good fit for what we do, then you fall into that 85% success rate, which is very high in this profession. So we do offer a service that works if we think you're a good fit, and after 30 plus years we can determine if you're a good fit or not. But hopefully this makes you better understand why you've been misdiagnosed and undiagnosed, and doctors are not appreciating how all these symptoms come together to make hiatal hernia syndrome. So if you need help, we're here for you. If you like the information on this channel, please subscribe. More subscribers equals more people being able to see this, equals more people being able to get help. So I do appreciate you so much, that you who have subscribed, you who are watching this video. Give it a thumbs up if you like it, and we'll talk soon.